Hi everyone, welcome back to our channel. Today we will discuss about the most important scenario based questions for the mains exam in NORCET and other exam also. Let's start. First question. A patient is admitted with acute pulmonary edema. The nurse notices pink fortis sputum, severe dyspnea and restlessness. What should be the priority nursing action? A patient admitted with the acute pulmonary edema, the nurse notices pink fortis sputum, severe dyspnea and restlessness. What should be the priority nursing action? Option is administer IV fluids rapidly. Option B, place the patient in high Fowler position. Option C, encourage deep breathing exercise. Option D, provide oral fluids. The answer is option B, because positioning reduces the venous return and eases breathing. Oxygen and diuretics follows, but first priority is positioning to prevent the hypoxia. So the answer is option B. Next, a 32-year-old woman, G2P1, presents with the painless vaginal bleeding at 32 weeks of gestation. On ultrasound, placenta is seen covering the cervical OS. What is the most appropriate nursing intervention? Option is option A, perform the vaginal examination. Option B, prepare for immediate C-section. Option C, start the oxytocin infusion. Option D, monitor fetal heart rate and avoid the vaginal examination. The answer is option D, because it is the condition of the placenta previa. In placenta previa, never perform the vaginal examination. Only monitor the fetal heart rate and prepare for the C-section or cesarean delivery. So the answer is option D. Next, next question. A patient with chest pain and brought to the emergency. ECG shows ST elevation in the anterior leads. The doctor prescribes morphine. Which nursing assessment is most important before giving the morphine? Option A, blood pressure and respiratory rate. Option B, pain score. Option C, urine output. Option D, temperature. The answer is option A, blood pressure and respiratory rate, because morphine may cause the hypotension and respiratory depression. So assess the vital signs before the administration of the morphine. So the answer is option A. Next, a child with nephrotic syndrome is on corticosteroid therapy. The nurse should monitor for which complication of long-term therapy? Option A, hypoglycemia. Option B, growth retardation. Option C, hyperkalemia. Option D, increase the immunity. So the answer is option B, growth retardation, because in corticosteroids the immunosuppression, Cushing features and osteoporosis or growth retardation. So the complication is like that: immunosuppression, Cushingoid features and osteoporosis, growth retardation. So the answer is option B. Next, an unconscious patient is admitted with head injury. The nurse notes clear fluid drainage from the ear. What is the next best action? Option A, suction the ear canal. Option B, send fluid for the glucose test. Option C, apply tight dressing to stop the leak. Option D, insert the air plug. The answer is option B, send fluid for the test, glucose test, because clear drainage may be the CSF, cerebrospinal fluid. Glucose test confirms the CSF leakage, and avoid packing or suctioning. So the answer is option B. Next, during a blood transfusion, the patient develops chills, fever and back pain within 10 minutes. What should be the first nursing action? Option A, slow the transfusion rate. Option B, stop transfusion immediately. Option C, give paracetamol. Option D, inform blood bank after the transfusion. The answer is option B, stop the transfusion immediately, because when the acute hemolytic reaction occurs within the 15 minutes or any time, we have to first stop the transfusion, maintain with the IV with NS, IV with normal saline, then we have to inform the physician. First stop, then IV, then we have to inform the physician. So the answer is option B. Next, a patient with COPD, chronic obstructive pulmonary disease, is on oxygen therapy at 6 liters per minute via nasal cannula. The nurse noticed increasing drowsiness. What is the causes? Option A, oxygen toxicity. Option B, hypoxic drive suppression. Option C, infection. Option D, anxiety. The answer is option B, because COPD patient rely on the hypoxic drive. High O2 can suppress the respiration, so it can occur the CO2 necrosis. So we have to do the hypoxic drive suppression. So the answer is option B. Next, in a post-operative thyroidectomy patients, the nurse observes steroid and difficulty in breathing. What is the immediate nursing intervention? Observe stridor and difficulty in breathing. Stridor. What is the immediate nursing intervention? Option A, suction the airway. Option B, prepare for the tracheostomy. Option C, give calcium gluconate. Option D, administer sedative. The answer is option B, prepare for the tracheostomy, because stridor is known as the airway obstruction due to laryngeal edema or the hematoma. In emergency, tracheostomy setup should be needed immediately. So the answer is option B. Next, a patient with diabetes is found unconscious with sweating and tachycardia. What is the nurse's immediate action? Option A, check urine for the ketones. Option B, administer IV regular insulin. Option C, give IV 50% dextrose. Option D, assess the respiratory pattern. The answer is option C, because classical hypoglycemia sign is treat immediately with the IV in glucose in unconscious patient. If the patient is conscious, we give the orally. When the patient is unconscious, then we will give the IV route. So the answer is option C. Next, a 55-year-old patient is admitted with suspected myocardial infarction. Which lab test is most specific to confirm MI? Option A, CKMB. Option B, troponin I. Option C, LDH. Option D, myoglobin. The answer is option B, troponin I. in troponin I or T are the highly specific and sensitive for the myocardial infarction. It's elevated within the 3 to 6 hours. So the answer is option B. Next, a nurse is caring for a patient with peritoneal dialysis. The outflow fluid appears cloudy. What should be the next action? Option A, continue dialysis as usual. Option B, notify physician immediately. Option C, warm the dialyzer. Option D, increase the exchange volume. The answer is option B, notify the physician immediately, because cloudy effluent indicates the peritonitis, inflammation of the peritoneal cavity. So it is a serious complication. We have to immediately inform to the physician. So the answer is option B. Next, a primigravida in active labor complains of severe back pain. The fetus is in occiput posterior position. Which nursing intervention is most effective? Option A, supine position. Option B, apply sacral counter pressure. Option C, administer tocolytics. Option D, perform the fundal massage. The answer is option B, apply the sacral counter pressure, because apply sacral counter pressure relieves the back pain caused by the fetal head pressure on the sacrum. When the baby is calm in the occiput posterior position, then it causes pressure into the sacrum. So if you doing the pressure or apply the sacral counter pressure, it will be helpful. Next, a patient on digoxin therapy develops nausea, vomiting and yellow vision. Which lab value is most important to check? Option A, potassium level. Option B, sodium level. Option C, calcium level. Option D, magnesium level. The answer is option A, potassium level, because hypokalemia, when the potassium level is decreased, normal level is 3.5 to 5.2 MEQ per liter. When it down less than 3.5, when the hypokalemia increases, then digoxin toxicity risks can be occurs. Must monitor when it showing the vomiting and yellow vision, the potassium levels. So the answer is option A. Next, a nurse finds a patient having tonic-clonic seizure. What is the priority nursing intervention? Option A, insert tongue blade. Option A, restrain limbs. Option C, turn patient to side. Option D, start CPR immediately. The answer is option C, turn patient to side, because sideline prevents the aspirations. Do not restrain or insert object into the mouth. So the answer is option C. Next, a 2-year-old child with severe diarrhea is lethargic, sunken eye and poor skin turgor. What is the best management? Option A, oral rehydration solution ORS. Option B, plain water orally. Option C, IV fluid therapy. Option D, antidiarrheal drugs. The answer is option C, IV fluid therapy, because in severe dehydration needs to IV fluid replacement. ORS is for the mild and moderate cases, and plain normal water we didn't use in the diarrhea. or so the answer is option C, IV fluid therapy. Thank you everyone. Please like, share and subscribe. If you like the video, please share and subscribe our channel. We will discuss another set from tomorrow. Thank you everyone.